Good morning, everyone. Good morning, colleagues. It's really fantastic that you are here and we are continuing today. We have, we're going to just introduce people that came in late last night. I think there's a couple of Kenyans that are one young, naughty, grey-haired one, and another younger Kenyan that came in late. I don't know where she is. She's outside still, okay. Lukoye, good morning.
Morning.
Thank you so much, Mr. Dean, for joining us.
Thank you very much.
I know that you've got a very busy schedule. So my job is just to welcome everyone again on the second day, and I think, and maybe recap a little bit from yesterday. And I think for me, as I said at the beginning of yesterday, this meeting is one of those that are really feel-good meetings. It's you work hard throughout the year, and then you come here, and it's so wonderful to see colleagues, friends who are doing great work and inspiring us. Some of the most amazing things for me was, listening and reflecting on Jimmy Bowling's keynote address yesterday about equity. Firstly, Jimmy, I think it's fantastic how much you've done at Stellenbosch University. It really is. And it's wonderful to see the transformation and also to hear the stories behind that, about some of the personal insults that were flung to you. I think the one thing that I thought would be interesting to reflect on this morning is where we are in our own places. How do we make our own departments, our own medical schools support equity? What does that mean? We work for institutions where they don't like to be flexible. If a lecturer comes and says, I want to be a mom and I only want to work 5 hours a day, it's such a huge fight. You have to write 500 different things, and it's so difficult for the system to kind of help us to try and go towards equity. But it would be really interesting to have these conversations about what does it mean if you've got a clinician in your department who just wants to do clinical work and doesn't want to do any research, or a researcher in the department who doesn't want to do any clinical work and just wants to do research, and how do we try and help people do what they want to do and really be good at it. And then the talks in the afternoon after that were really continuing the work that people are doing. Some excellent work being done in New York, in Durban, and I think that there's been quite a bit of discussions following Talatala's brief intro about using the legal system, about advocacy. I think we really need to take that up. I know that many of us here would be very worried that they don't have the skills to talk to lawmakers or to talk to politicians. In fact, they would be very worried if we said to them they must take the government to court. Because we don't even know that the different arms of the justice system, the criminal, the civil, all those different ways. So perhaps it is our duty in this institute to kind of upskill some of our members as we go back to our countries and speak to lawmakers and try and improve access to care for mental health. There are, I guess we could perhaps look towards people like Michelle, who is involved with quite a lot of work with the APA, the American Psychiatric Association. I don't know if the colleagues know that the APA spends a huge amount of money and time lobbying the government in the United States. Not just the federal government, but the state government, but apparently also locally. So Michelle's got quite a bit of experience with that, so maybe we could ask her to help us think through about what that looks like, to translate it to the kind of work that we want to do on the continent. The history is so important. I think Dr. Jordan really demonstrated that the way that we look at the justice system in the United States and those black men that are filled in those jails is really because of some decisions that were taken by lawmakers around criminalizing drug abuse. And we need to do much more to try and really to correct those things. We know that mental health is stigmatized, but we also know that addiction is stigmatized even within mental health. So imagine if you're black and you've got addiction issues, how difficult it would be. And then we did some work in the afternoon, and it's looking forward to the feedback from different working groups. Hopefully continuing on from the different working groups that we had over the last couple of years. So that's what we'll be doing this morning. We'll be giving feedback from the work that was done this afternoon. I hope the slides have all got to you tonight before 8 o'clock.
Almost. One more.
One more. And then I think the highlights for me will be the presentations from the emerging researchers that we have. I think it will be wonderful to see the breadth of the work that's been happening on the continent. And then we'll end off with some steps going forward. Dave had a fantastic conversations with some key farmer leaders last night at dinner. And I think they promised you how many millions of US dollars? $5 million US dollars. So hopefully there'll be more money for us to do some amazing things. Yeah. So can I ask you, Dave, to come up and introduce us to a keynote address this morning? Thank you very much.
Hi, good morning, everyone.